more.
Maryland Spotlight. It's all about Maryland living.
Welcome to Maryland Spotlight. I'm Kim Knight. For 50 years, GBMC has been providing quality care to the community, but it's more than just a hospital. Joining me is Dr. Robin Motter-Mast, and you are the chair of the Department of Family Medicine. Thanks for being here.
Thank you for having me.
Yeah. Now, GBMC has locations across the county, and they are certified as patient-centered medical homes. What does that term mean?
So GBMC has 10 patient-centered medical homes across the Baltimore region. So our patient-centered medical homes are actually a level 3 NCQA standard. And what that means is we're really trying to practice better patient engagement between the providers and the patients that we are treating.
Now, how does this differ from an urgent care center, one that you would just walk into? Tell me about that.
So there's a big difference between an urgent care and a patient-centered medical home. So we really want the patient-centered medical home to be your medical home, where you come over not just for one episode or one case of a sore throat, but actually to receive all of your medical care throughout most of your life, or at least have a very strong relationship with a provider that you feel that you can go to on a regular basis. We have increased the access at our patient-centered medical homes so that you really don't have to go to an urgent care, that you can actually come to your doctor's office. So many of our offices now have hours between 7 a.m. and 7 p.m. And we've even added hours on Saturdays and Sundays so that you can find your home at our office.
Yeah, that's very convenient. It really is. Now tell me, how do the teams manage population health?
So population health is something that's really new to the patient-centered medical home. And when we talk about patient-centered medical home, a couple of things that have been added on that make practicing medicine better for the provider and better for the patient are population health. Population health is managed by our care teams in our offices, and our care teams are made up of a nurse care manager who works with chronic disease. So for instance, if you had diabetes and you needed a little help in between your visits with your provider, you could spend some time with our care manager and she could help you out along the way. We also have a care coordinator in the office, and she functions kind of like a social worker. So if you happen to have an ER visit or you are hospitalized, this person would contact you and try to help to make sure that you have your follow-up appointment or that you've received any of the type of care that was recommended from your discharge.
Well, it sounds really convenient. Is GBMC the only hospital using this approach?
We are not, but I would like to think, and I do believe, that we are one of the hospitals that are using it the best.
And yes,
we've engaged in this process since 2010, and so we have 5 years under our belt. And part of what we have done over the last 5 years is also participated in an accountable care organization, and this really kind of broadens our patient-centered medical home. And we look at more than just our offices, but the region and how we can affect our patients within the region.
Right. Well, definitely great for the community, and if anybody wants to get information, it is gbmc.org. Doctor, thanks so much for being here today.
Thank you very much for having me.
And thanks for joining us today on Maryland Spotlight. I'm Kim Knight.